Understanding sexually transmitted diseases, or STDs, is essential for protecting your health and the well-being of your sexual partners. STDs are infections passed from one person to another through sexual contact. They are a common health concern, affecting millions of people each year. These infections are caused by various organisms, including bacteria, viruses, and parasites. Chlamydia is one of the most prevalent STDs, caused by the bacterium Chlamydia trachomatis. It often doesn't cause noticeable symptoms, especially in the early stages. This can be dangerous, as untreated chlamydia can lead to serious health complications, particularly in women.
If symptoms do occur, they might include unusual discharge or pain during urination. The good news is that chlamydia is easily treatable with antibiotics. Early detection and treatment are essential to prevent long-term health issues. Regular testing is recommended for sexually active individuals, especially those with new or multiple partners.
Gonorrhea is another common bacterial STD caused by Neisseria gonorrhoeae. Like chlamydia, gonorrhea often doesn't cause symptoms initially, making regular testing crucial.
When symptoms do appear, they might include painful urination, abnormal discharge, and pelvic pain in women. Gonorrhea can also lead to serious complications if left untreated, including infertility and pelvic inflammatory disease. Fortunately, gonorrhea is curable with appropriate antibiotics. Early diagnosis and treatment are vital to prevent lasting health problems.
Human papillomavirus, or HPV, is a group of viruses, some of which can cause genital warts and certain types of cancer. This virus is incredibly common, with millions of new infections occurring each year. Despite its prevalence, many people are unaware of the potential risks associated with HPV. Most HPV infections are cleared by the body's immune system without causing any health problems. In fact, the majority of people who contract HPV will never even know they had it, as their immune system effectively fights off the virus before it can cause any noticeable symptoms.
However, some high-risk HPV types can lead to cervical cancer, as well as cancers of the vulva, vagina, penis, anus, and throat. These cancers can develop years or even decades after the initial infection, making it crucial to understand the long-term risks associated with HPV. There is no cure for HPV, but there are ways to protect yourself. Practicing safe sex, such as using condoms, can reduce the risk of transmission. Additionally, limiting the number of sexual partners can also help lower the chances of contracting HPV. Vaccination is available and highly effective in preventing infection with the most common cancer-causing HPV types. The vaccine is recommended for both boys and girls, ideally before they become sexually active, to ensure maximum protection against the virus. Regular cervical cancer screening is essential for early detection and treatment. Pap smears and HPV tests can identify abnormal cells before they turn into cancer, allowing for timely intervention and significantly improving the chances of successful treatment.
Section 5. Herpes, a lifelong companion. Herpes is a viral infection caused by the herpes simplex virus, or HSV. This virus is highly contagious and can be transmitted through direct contact with an infected person. There are two types of HSV: HSV-1, which usually causes oral herpes, also known as cold sores. These cold sores are often painful and can appear around the mouth and lips, making it uncomfortable for the person affected. And HSV-2, which typically causes genital herpes. Genital herpes can lead to sores and blisters in the genital and anal areas, causing significant discomfort and emotional distress. Both types can cause sores and blisters in the affected areas. These outbreaks can be triggered by various factors such as stress, illness, or a weakened immune system.
Herpes is a lifelong infection, but outbreaks can be managed with antiviral medications. These medications help to control the virus, making it less likely for outbreaks to occur frequently. These medications can reduce the frequency, duration, and severity of outbreaks. By taking antiviral drugs, individuals can lead a more comfortable life with fewer disruptions caused by the virus. While there is no cure for herpes, understanding how to manage the virus and prevent transmission is crucial. Practicing safe behaviors, such as using condoms and avoiding contact during outbreaks, can significantly reduce the risk of spreading the virus to others. Education and awareness are key in managing this lifelong companion.
Section 6. Transmission: how STDs spread. STDs are primarily transmitted through sexual contact. This includes vaginal, anal, and oral sex. Some STDs, like herpes, can also spread through skin-to-skin contact with an infected area. It's important to remember that you can contract an STD even if your partner doesn't show any symptoms.
Sharing needles or other drug injection equipment can also transmit certain STDs, such as HIV and hepatitis C. Additionally, some STDs can be passed from a pregnant woman to her baby during pregnancy or childbirth.
Section 7. Recognizing the signs, symptoms of common STDs. Understanding the symptoms of sexually transmitted diseases is crucial for early detection and treatment. Many STDs don't cause noticeable symptoms, especially in the early stages. This is why regular testing is crucial. Regular testing helps in identifying infections that might otherwise go unnoticed, preventing complications and the spread of the disease to others. However, when symptoms do occur, they can vary depending on the specific infection. Each STD has its own set of symptoms, and understanding these can help in seeking timely medical advice. Common symptoms of STDs include: these symptoms can range from mild to severe and can affect different parts of the body.
Unusual discharge from the vagina, penis, or anus. This discharge can be a different color, consistency, or have an unusual odor indicating an infection. Pain or burning during urination. Sores, blisters, or warts on or around the genitals, anus, or mouth. These sores can be painful and may take time to heal, often requiring medical treatment. Pelvic pain in women, pain during sex. Swollen lymph nodes in the groin area. These symptoms can significantly impact daily life and intimate relationships, making it essential to address them promptly.
If you experience any of these symptoms, it's important to see a healthcare provider for testing and treatment. Early diagnosis and treatment can prevent complications and improve quality of life. Don't hesitate to seek medical advice if you suspect you might have an STD. Regular checkups and open communication with your healthcare provider are key to maintaining sexual health. Section 8. Prevention is key. Protecting yourself and your partners. Preventing STDs is crucial for maintaining sexual health. The most effective way to prevent STDs is to abstain from sexual activity. However, for those who are sexually active, several methods can significantly reduce the risk of infection.
Condoms, when used correctly and consistently, provide a barrier against the transmission of many STDs. Dental dams, thin sheets of latex or polyurethane, can be used during oral sex to reduce the risk of infection.
Section 9. The importance of regular testing. Regular testing for STDs is essential, even if you don't have any symptoms. This is because many STDs can be asymptomatic, meaning you can have an infection without knowing it. Regular testing allows for early detection and treatment, reducing the risk of complications and preventing the spread of infection.
The frequency of testing depends on your individual risk factors, such as the number of sexual partners you have and your sexual practices. Talk to your healthcare provider about how often you should get tested for STDs.
Section 10. Open communication. The foundation of healthy relationships. Open and honest communication with your sexual partners is crucial for maintaining sexual health. This includes discussing your sexual history, getting tested for STDs together, and making informed decisions about safer sex practices.
Talking about STDs can be uncomfortable, but it's a sign of respect and care for yourself and your partner. By communicating openly, you can make informed decisions about your sexual health and reduce the risk of infection.
Section 11. Taking charge of your sexual health. Your sexual health is an integral part of your overall well-being. By understanding STDs, practicing safer sex, getting tested regularly, and communicating openly with your partners, you can take charge of your sexual health and reduce your risk of infection.
Remember, knowledge is power. The more you know about STDs, the better equipped you'll be to protect yourself and your partners. If you have any questions or concerns about STDs, don't hesitate to talk to your healthcare provider.